Hello, my name is Stephen Houghton, and I'd like to thank you for taking the time to listen. I've been in the healthcare field temporarily for a couple of years now, and I have a lot of family members and friends that are in the healthcare industry. And stressing the topic of self-awareness and personal health is a very important issue to myself, and it should be for you as well. I feel that the best way to stay healthy and protect yourself is to be well informed, which is why I've chosen to be an advocate for health awareness and talk about a very serious and sensitive topic. Today I'd like to raise awareness about HPV. Some of you may or may not have heard about this virus, but HPV is short for Human Papilloma Virus. It is a real threat to women, men, and even young girls. So what is it? HPV is a sexually transmitted disease, and it spreads from person to person. I have a board here that we can look at with just a few facts on HPV. There are 30 types of HPV. Every day, about 12,000 people ages 15 to 24 are infected by HPV. HPV can clear on its own. You don't have to have sex to get HPV. Every day, 30 women are diagnosed with cervical cancer. 1 million cases of genital warts in the United States alone. Even after treatment, warts may return. HPV is also linked to other types of cancer like vaginal cancer. Half of men and half of women have this STD, so that's 1 in every 2 men and women that you come across every single day that may have this virus. 150 women a year are diagnosed with cervical cancer. This is a microscopic view of HPV. Picture the vaccine, a papilloma sore, and a genital wart. Probably can't see it too well. But the cases of HPV are growing daily and rapidly. Now, the reason I bring this disease up is because it can be very serious. It's also preventable and treatable. HPV, for a lot of people, can be symptomless. A person can still contract this while using condoms, and the reason for this is that some strains of HPV can cause genital warts and anal warts that obviously a condom is not protecting. Warts can affect both men and women. They both can be found on the cervix, the labia, the vulva, the penis, and the anus. Warts are disfiguring and embarrassing, and I've seen people feel very terrible when they are diagnosed with not only that, but worse, cervical cancer. I've been with patients that have had to have uncomfortable procedures done. They get very upset when they're diagnosed. So the question ultimately is, what can you do to prevent HPV? For one, men and women should take precautions when having any sexual activity. It doesn't hurt to look or to ask. For two, women need to be getting annual pap smears as well as tests for HPV and any kind of sexual transmitted diseases. But just getting a pap smear does not protect or give you the correct diagnosis for HPV. Three, I think just being proactive about your own health, as well as informing the many people around you about this virus, is important, because there's very many people that don't even know that this virus exists. There are tests, treatments, and vaccines. For many women who are diagnosed, they end up having to go through painful and uncomfortable procedures like a colposcopy, which they can view the cervix microscopically and even do a biopsy if they suspect cervical cancer. Then she would, if she's diagnosed with cancer, go through cancer treatments. Some women may have fertility issues after having cervical cancer. Some treatments can be surgical, and some are just topical medications for warts. Some of you may have heard the vaccine for HPV called Gardasil, which was approved by the FDA in 2006. 4 types of HPV are covered with this vaccine, and say if you only had one of the types of HPV, you would go through a series of 3 shots, and they would protect you from all strains of HPV, which is a good thing. Gardasil has been approved for women and girls and young women as young as 9 years old. There's been a lot of controversy with this vaccine as it's helped and protected many women, but there's been a lot of complaints as well, some of which have been from teen girls claiming they have serious pain, neuropathy, and even temporary paralysis. There was even a school trying to make it mandatory for the young girls to get vaccinated. Some of the patients were obviously not happy and didn't agree, as their parents also did not approve and argued that their child was not sexually active. In any case, this is a decision that's made personally for each individual for themselves. And regardless, HPV is a serious issue that can't be overlooked, but it can be easily overlooked. I hope I've been able to arm you and educate you with some knowledge and awareness about this virus, and I sincerely urge you to take every precaution and measure necessary to protect you and your loved ones against the rampant virus HPV. Thank you, and have a wonderful day, everybody.